First at 4, breaking news. Governor Whitmer isn't ready to reopen Michigan. We'll tell you what she just said about extending her stay-at-home order. Also, we've learned the first death in the United States happened much earlier than we thought. Dr. McGeorge tells us why that makes a big difference. Paula.
If you've lost your insurance and your benefits and you feel like you don't have access to medical care, well, a new program says the doctor will hear you now. I'll explain.
Paula, we are slowly getting rid of the snow, transitioning though to rain. The question is, when will we get these temperatures to some respectable numbers? Answers are right now, first at 4.
Local 4 News starts now with a breaking news alert.
Good afternoon, I'm Karen Drew. First at 4, Governor Whitmer indicates that Michigan's economy will open slowly and deliberately. It's one of today's key developments in the coronavirus crisis. First, in Detroit, Mayor Mike Duggan reported 17 new deaths in the city. He says it's one of the lowest numbers we have seen, but it is too soon to call a trend. He also added that data from the city's hospitals is also heading in the right direction. Now, statewide, we are now up to nearly 34,000 coronavirus infections, and we've now lost more than 2,800 people. You may have just seen Governor Whitmer talk about extending her stay-at-home order. Local 4's Kimberly Gill in the newsroom. And Kim, we're all waiting to see exactly what happens next.
Yeah, that we are, Karen, and good afternoon to you. Republican lawmakers unveiled their plans to reopen the state about 2 weeks ago, but the governor has not followed suit. This afternoon, she indicated that some form of her stay-at-home order will be in effect past April 30th.
I want to be clear, we will likely need another short-term extension of the stay home, stay safe order. When we do start to re-engage, it will have to be very thoughtful and precise, mitigating risk to all and mitigating the risk of a second wave. But we will start to re-engage.
The governor says she will have a plan to reopen as we get closer to April 30th, when the current order is set to expire. Right now, the governor says her concern is avoiding a second wave of infections. Whitmer says the state's current mitigation efforts are working as hospitalizations have decreased by 15% over the past 10 days. She also announced temporary layoffs in state government for 10 work days. The governor says while COVID-19 testing was highly targeted at first, now she wants more people to get tested.
Testing is the only way that we will know where the virus is so that we can appropriately deploy our resources to slow the spread. If you have symptoms and believe you came in contact with someone who tested positive, find your nearest testing site and get tested.
And if you do want to get tested, you can find a location online at michigan.gov/coronavirus. You should probably still call ahead before showing up, though. So, Karen, right now the governor is working on a plan to reopen the state, she says, in phases, but we're still waiting for the details on what that exactly will look like. We're starting to gather reaction to all of this for tonight on the news at 5. So let me get back to work and I'll see you then.
All right, sounds good. Thank you, Kim. Yep. New test results have shaken up the coronavirus timeline that medical experts have been using to track the crisis. Santa Clara County over in Northern California says a person who died in their home on February 6th had coronavirus. The CDC has now tested tissue samples from that person's autopsy. That death came weeks before what we thought was the first death, previously reported on February 29th in Kirkland, Washington. Our Dr. Frank McGeorge tells us why this new information is so critical.
The first deaths are significant for a number of reasons. First, we know that deaths tend to lag behind infections by about 2 weeks. So that means the virus was circulating even earlier than February 6th. Now, second, the models that are used to make predictions in an outbreak rely heavily on knowing when it started. Change the start and you change the model and alter the predictions. But there is something even more critical about this February 6th death, and that's how the person was likely infected. Coming up at 5, I'll break down the timeline and what this could all mean for Americans now and down the road.
The House of Representatives will vote tomorrow on a new coronavirus relief package, even as the House Speaker tries to change how Congress votes. Senate passed the nearly $500 billion plan late yesterday. Contains money for small businesses, hospitals, and coronavirus testing. Speaker Pelosi wanted to allow lawmakers to vote by proxy in the future, but Republicans shot down the idea. proposal is now under review. Pelosi also wants to form a new committee to track the relief spending. That idea will require a vote in the House. Today, we were given another look inside the TCF Center alongside the U.S. Secretary of the Army. Secretary Ryan McCarthy toured the makeshift hospital set up to house coronavirus patients. Right now, we are told there are 17 patients at TCF. The center in downtown Detroit currently holds 970 beds. Right now, no patients are being treated at Novi's Suburban Collections Showplace. It was transformed into a field hospital with 250 beds, just in case we saw a worst-case scenario with coronavirus infections. The hospital had already scaled back from the 1,100 beds originally planned. If you don't have a doctor right now, finding medical care can really be tricky during this pandemic. A local free walk-in clinic has already secured funding to take care of uninsured and underinsured patients. Now, our Paula Tutman tells us that clinic is shifting its mission to telemedicine and is showing us how it all works.
I think we're all getting used to this look, and while it may not be ideal, it's pretty important for the times we're in right now, particularly for those who've lost their insurance, their benefits. They may feel like they don't have access to medicine or a physician, but a new program by an organization in Dearborn says the doctor will see or hear you now for free.
Hello, sir. My name is Dr. Saad. How can I help you today?
This is what telemedicine looks like and sounds like.
What's going on?
Dr. Hussein Saad is a physician for the free clinic program by C-Assist in Dearborn. Now, this particular call is with a patient, but not a patient in acute need. Jim Corey has allowed us to peek in as he discusses his case with his physician so we can see how telemedicine works.
Via the video, I was able to show him my range of motion, and he's actually able to really figure out which ligament I might have strained, and gave me some exercises to do and stretches to do to try to minimize the pain.
What's great about understanding this kind of medicine is for anyone in Michigan, anyone at all who has lost their benefits because of layoffs or didn't have health care or even adequate health care, free help is a phone call or laptop away.
Any fevers or chills?
No.
As C-Assist launches a 3-month program to make sure everyone has access to a doctor and follow-up care.
If you don't have health insurance and you need to speak to a physician, you can call our number and we'll be able to assist you with trying to take care of your medical issues.
The program is privately funded by the National Association of Free Clinics, the Flynn Foundation, and Islamic Relief through C-Assist Free Clinic. Anyone seeking medical attention can call, make an appointment to telespeak to a physician who will guide them through getting plugged into actual medical attention. If follow-up is needed, that too is free.
Have you had any injury at all to the shoulder? Did you injure it?
Just like any other doctor, you do need to call for an appointment. We'll put the number on our social media platforms. And remember, it doesn't matter where you live in Michigan. The doctor will hear you now. Paula Tutman, Local 4.
The C-Assist Doctor Telemed program is funded through June, but the director says they will find additional funding if necessary. Now, keep in mind, you do need an appointment. We'll put contact information on our social media, including clickondetroit.com. Just look for the health page. Now let's move on to a record cold you are feeling outside if you have ventured outdoors. Ben, it's supposed to be spring. Does not feel like it at all. So when do we get some relief?
Not a chance. The numbers are only going up from here, Karen. If we can get through today, we will be seeing 50s starting later this week. However, today, as you mentioned, that potentially record cold number, we're at 37 right now. The coldest record high is 40, so we are definitely in that territory as we see snow showers still falling in parts of the area. Let's go to 4 Live radar. There's not a ton of it out there, but you can see, at least in the northern parts of the area, a couple blue shades showing up, and they're starting to be replaced by rain showers. Back out to the west, you can see there's some areas of precipitation that are starting to move in from cold water, a little bit more intense, maybe seeing some snowflakes mixed in there, but primarily that's going to be rain. Temperatures are going to be relatively steady tonight, right around 40 degrees, but there is improvement in that 7-day forecast, and we'll look at for you in just a few minutes. Karen?
Right. Thank you, Ben. Still ahead, we're going to talk about toys, how one big company is celebrating Earth Day, and something new from Build-A-Bear that might entertain your kids. Also, one couple's long battle to become parents is finally over. The details of their medical miracle, still very surprising, if not record-breaking. and a new crisis overseas, what this video could say about Iran's military plans, and the new threat from President Trump. We'll be right back.